Hello, I'm the Reverend William Purdy with the Hospice and Palliative Care Association of New York State. We've compiled the answers to some of the most frequently asked questions we receive about hospice care. So who qualifies for hospice care?
Well, there are just two requirements. The first is life expectancy of 6 months, and the second is a desire to receive hospice care.
Well, it's hard to know how long any of us will live, so how exactly is that determination made?
Well, we become eligible for hospice when two physicians agree that our illness, whatever it may be, if it were to run a typical course, our life expectancy would be about 6 months. The sooner people access hospice, the more they can benefit from its services.
So what about people who live beyond 6 months? How long can a person receive hospice care?
A person can receive hospice care for as long as they need it. The determination to continue on with hospice is based on medical criteria that the hospice team reviews every 14 days. The more frequent scenario, though, is that people come on the program very late, and there's so much that hospice can do when it's involved early.
You mentioned the second requirement is a desire to receive hospice care.
When people choose hospice, they're redirecting their focus from treatments in search of a cure to palliative care. Because no cure exists for their disease at this time, and invasive procedures, surgeries, other interventions, they can often become more burdensome than beneficial. When we choose hospice, we want all the care that is appropriate. The hospice team includes a physician and a nurse who work to accomplish the patient's own treatment goals, goals that include physical symptom management, especially pain control, and other help with both the patient and the family with other issues as well.
What kind of doctors and nurses work for hospice?
Most hospice doctors are board certified in palliative medicine and hospice, meaning that they've received advanced specialized training and passed rigorous exams to take care of people who are the most seriously ill. What patients love the most about hospice doctors is how they combine their medical knowledge with the ability to listen to what patients have to say. Hospice nurses are skilled at providing reassuring care and monitoring the necessary medication levels to achieve comfort.
Well, can patients keep seeing their own doctors when they're on hospice?
Yes, whoever the patient chooses as their primary care physician is up to the patient. How it usually works is the hospice doctor consults with the patient's own physician. It's a team approach to provide the best care possible.
Does my primary physician have to be the one to refer me to hospice in the first place?
Well, that's usually the way it works, but anyone can ask to be assessed for hospice care. Hospice will contact the primary physician for his or her input, but finally, the decision to accept hospice is up to the patient or the healthcare agent once it's decided that the patient is eligible.
You mentioned that the hospice team is interdisciplinary. Can you describe the team more?
There's a social worker, and when desired, a chaplain to provide emotional, spiritual support to the patients, their family, and friends. Hospice aides also assist with care. Alternative therapies may include art, music. Volunteers help out a lot. And bereavement follow-up for family and friends is an integral part of hospice.
What if I have to go to the hospital in an emergency? What happens then?
Of course, for an emergency that cannot be handled at home, patients should go to the hospital. It's also important to notify your hospice immediately of an emergency. Hospice clinicians are always available around the clock, and hospice will take care of the needed arrangements. That way, there is no interruption in services. Now also, hospice strives to prevent unnecessary hospitalizations, which can result in complications like infections. And that's one reason we believe that hospice patients tend to live longer than patients not on hospice.
You mentioned palliative care. What exactly is the difference between hospice and palliative care?
Well, palliative care is about managing illness, treating the symptoms so that we can live our lives as fully as possible despite the illness. Actually, much of medicine is palliative, though we might not know it. For example, since there is no cure for high blood pressure, the medical treatment is palliative. Medication to help keep our blood pressure at a safe level. But say the high blood pressure leads to a stroke, one from which recovery is impossible. Well, in that case, the palliative care may well become hospice. Palliative care patients may at the same time be seeking to undergo curative treatments or experimental therapies like drug trials. Hospice patients, on the other hand, are not seeking to undergo treatments intended but not proven to be curative.
So how is hospice paid for?
Medicare, and in New York, Medicaid, and most private insurers pay for hospice. So usually, hospice does not cost the patient or their family. Hospice also pays for and provides the drugs necessary to manage the hospice diagnosis. It also provides the equipment necessary to help people remain in the comfort of their own homes, wherever that may be, including nursing homes and assisted living facilities.
So what happens when a person needs more care than the family can provide at home and the family can't afford to augment hospice care?
Well, hospice can help people identify all the benefits that they're entitled to. If a family has the means to care for loved ones, most do so willingly. Where funds are lacking, hospice can help people apply for Medicaid and other programs. If caring for a patient at home becomes overwhelming, periods of respite care can be arranged for the family. Hospice also has many skilled nursing and assisted living facilities. Sometimes increased nursing at home can make the patient's safety and comfort more certain. In cases where more skilled nursing is needed on an acute basis for limited periods, hospice can give round-the-clock nursing in the home.
Thank you for visiting the Hospice and Palliative Care Association of New York State. We hope the videos on this website have answered many of your questions. We especially want to emphasize that both hospice and palliative care are available for people of every age, adults and children, and that hospice patients remain almost always in their own homes to receive care. To obtain additional information, please call us at this toll-free number, 800-860-9808, or while visiting the Hospice and Palliative Care Association website, click on the Find a Hospice or Find a Palliative Care program pages to locate an agency that serves your community.